Salivary diagnostics means that we have an ability to diagnose, prognose, treat patients earlier, to screen patients.
Well, the term salivary diagnostics is really a term that we have coined and engendered to look at the potential efficacy of markers in saliva.
The field of biomarker research is enormous already. This is just one added piece of it. I mean, we've been doing biomarker research for over 20 years.
So biomarkers is a way to look at these what I call constituents within saliva. These are genomic, proteomic, and metabolomic, and other information that constitute what I call diagnostic alphabets.
Alzheimer's, periodontal disease, a variety of conditions. Some reflection of that is found in the blood and also found in saliva.
And if we can detect, using salivary diagnostics, diabetes and heart disease, this could be a real game changer in the healthcare field.
The evidence is fairly strong. Again, early detection, well-managed diseases ends up in prolonged life.
I think when you are able to detect a cancer early and cure it, individuals are able to live a much freer life in many ways.
Patients going to be living longer. Will also be reducing medical costs. You know, most medical costs are really in the last year of life.
One of the key attributes or characteristics of the salivary diagnostic technology is this issue of non-invasiveness. The classic diagnostic modems are a blood draw, a spinal tap, a urinalysis.
Well, if you ask most people if they would like a needle in their arm or spit in a cup, they would prefer to spit in a cup. Salivary diagnostics can be really chairside, so point of care delivery where you'll get the information almost immediately.
Salivary diagnostics gives you the opportunity to go out, reach out to patients at a very low cost.
Because it is a rapid test, the agents are able to be done on site or even in a portable fashion.
Think about some of the world diseases and epidemics, malaria, tuberculosis. With a droplet of saliva, you could quickly ascertain a community, an entire community, and then can deploy whatever resources are necessary to help meet that health demand.
Dentistry has a very rich history of prevention and risk assessment.
The majority of our population see dentists more often than the physicians. You know, it's really positioning us at the front line of primary health care.
The only effective medical care is team care. And there's no question in my mind as a head and neck surgeon that in the front lines of the health team care for head and neck cancer is the oral practitioner.
In the dental office, in addition to the oral diseases and conditions, they're going to be diagnosing diseases that they then will be referring to their medical colleagues.
It means that the dentist must understand metabolism and metabolites, physiology and the consequences of abnormal physiology. That requires a recalibration of dental education and then continuing education.
We need to bring in all minds, all collaborators, medical professionals and non-medical professionals. But it's great to have a relatively new partner in this with Dr. Wong and my dental associates.
There's an art and science to dentistry, there's an art and science to medicine, but there's also an art and science to research.
It's the investment in research that has really paid off and has brought us to this point. It is changing the field of dental research, and it's expanding dental research into the rest of medical and health research.
The key to any successful research project is the infusion of new ideas and the continuation of those ideas to fruition. Without funding, the oil to the wheel is stopped.
Have that credibility of being a reimbursable item and is approved by the FDA is what is necessary.
It's the game changer. If there's no reimbursement, then many procedures that could be very interesting fall to the wayside.
We really need to have a solid investment in medical research in this country, and one way to do that is to make sure that our legislators are aware of this type of research.
Academicians have to join in, insurance carriers, industry. We're all in the business of improving health.
We could be looking at the real value of salivary diagnostic, enhancing our professional dentistry, and making medicine better.
Family medicine, primary care, pediatricians, internal medicine will find this very, very attractive on a whole bunch of levels.
This is a lifesaver. Early detection, early intervention saves lives. It's well documented, and we need to capitalize on it.